Hi there, welcome back everyone. As you may by now know, I'm Kelly Moses, public relations student with the University of South Africa, and I am working on a communications project with the Tygerberg Hospice. I'm back with one of the beneficiaries, Marlee. She'll introduce herself in a minute. And I just wanted to remind everyone that due to the current situation, that the interviews are filmed via Zoom just for the nature of their business and to safeguard everyone else. And yeah, let's find out a little bit more about Marlee and what she does. So tell us about yourself and what you do for the organization.
Thank you, Kelly, for the introduction. My name is Marlee Faro. I am the Community Development Manager for Tygerberg Hospice Trust. Initially, my background comes from a communication science background. So I've worked in the PR public relations industry for about 7 to 8 years initially before this. And then with COVID-19 happening around May, I joined the Tygerberg Hospice Trust team, where I started initially as a team leader, but right now my role is I am the team leader and the team manager for the trust from the patient care advisory committee side.
And just from your standpoint, how would you describe the Tygerberg Hospice and like what you guys do? Just a little bit about the hospice itself.
From how I would describe hospice, our main focus is patient care. So what we do initially is that we serve in the community to be able to provide patient care, quality patient care, and comprehensive quality patient care to the community we serve in. So we have two substructures, which is known as the Tygerberg and Northern substructure within the community we serve in. So under each of those, in the Tygerberg, for example, we service 4 areas, which is known as Bellville South, Uitzig and Ravensmead. And then in the northern substructure, we serve Durbanville, Santa Claus, Klipheuwel, and Philadelphia and Boterberg. And what we do in those areas is we provide professional nurses and healthcare workers that work at ground level to be able to give patient care to patients who can't afford to be able to have patient care. So our carers go in, they serve in the community, and our professional nurses provide medical care within the communities.
Amazing. You've already mentioned when you became involved with the hospice. Can I just ask what attracted you to the hospice essentially and the work you're doing now?
So, when you find yourself, you're going through life, and I'm young, I'm 30, so I shouldn't say I'm going through a midlife crisis. But, you find yourself at a point in your life where you think to yourself, what is my purpose? Does my job define making profit, or does my job serve a greater purpose? So I initially joined during the COVID-19 time because Tygerberg Hospice had a position available where they were busy with COVID-19. We were supporting isolation facilities in the substructure we serve in. So I was employed as a COVID-19 team leader, which I assisted with community screening and testing in the area that I served. And I also assisted with the Bertie Hotel that served as a quarantine and isolation facility. So I initially started as part of the COVID-19 team. And with that transgressed from the, oh, sorry, Kelly, I don't want to break your word.
No, go ahead. I was just agreeing with you and nodding. So go ahead, keep going.
Thank you. And then initially started as a COVID-19 team leader for the teams that we recruited to assist with the COVID-19 response team. So we had care workers that went into the community to do screening and testing. We had professional nurses who did all the testing in the communities that we serve in, because the Tygerberg substructure was known as what we call the hotspot, where the most COVID cases was happening. So there was an initiative for us to get into the community, start screening, start testing, to get ahead of the numbers, to be able to establish what can we integrate to bring down the figures in the substructure we serve in.
Amazing.
And then from then later on it transgressed, where we moved on to where I became more involved in the team. I also became part of the home-based care services that we serve. That landed me the role I'm in now, as where I serve as the community development manager for all the substructures. And then I also serve as a team leader for the Old Mutual Isolation Center, which means we only have positive patients currently in there, but we have healthcare workers and professional nurses serving in them as the period of isolation, because many of the people that we serve come from rural communities. So they come from homes where there's 10 people living in their homes. So we need to provide a safe space for them to isolate, which is we take them out of the community, we place them in the facility, they serve the isolation period, and then they return back into the community.
Amazing. I was just going to ask you a little bit about the current situation, which is the COVID-19 pandemic. But I think that you've covered a lot of what it is that you do and how you guys have had to adjust what you guys do in terms of your operation and relations. I'll just ask you, as things are going back to normal, the new normal, or slowly back to our previous way of doing things, is there maybe anything that will change, or for you will change, or that you guys are hoping to learn from this?
It's also what's allowed for in my time span I've been there, it's allowed for us to rethink how we communicate, firstly in the community, how we address the needs of our patients. So the stigma of COVID-19, many people don't want our healthcare workers in their houses because they feel that as healthcare workers, we are the frontliners. So we come in contact with constant people every single day. So they don't necessarily want us in their homes. So it's allowed us to rethink and redo how we serve in the community. So where previously WhatsApp communication has become very significant for us, when previously everything used to work on paper, black and white or face to face, but also to limit how we communicate, because obviously we can't have a 100 people in a room anymore.
Mm-hmm.
Or we need to think also how to keep our staff safe. So that one-on-ones aren't possible anymore, or those huge group meetings aren't possible anymore.
Mm-hmm.
So we've had to look at a space where we've created WhatsApp groups as a means of communication, which is instant, and it allows us to give feedback back to each other immediately. We've also had to look at how we communicate with our patients, because we usually would be going to the patient's home and so forth, but now we have to also work on more telephonic communication to advise the patient, would you like us in your home? Can we come into your home? Would this suit you? Because many people have the stigma, and so many people are so scared with COVID-19 that we've had to look at these different ways to reinvent ourselves, to be able to still give our patients the need they have, but also for us to work more rapid and fast together.
Amazing. So from what I'm getting from what you're saying is that you guys have basically had to find alternative means of like open two-way communication to make sure that you guys get
Yes.
possible service to your clientele or to your patients.
Yeah, yes, and also with our care workers, previously everything was paper, but we also know that with the virus, it stays on the paper for quite a while. So even with Department of Health, we started a project where our healthcare workers now do all the screening on a cell phone. So they've all been given a Huawei phone where if they go to the patient's home, everything gets captured on the phone, the data gets extracted from the phone, and it goes back to Department of Health, which makes it also safer because, everybody touches a piece of paper. And so we've also had to look at ways of how you can do all that in the patient's home without putting anybody at risk.
Amazing. And lastly, I'll just ask you, is there anything else you want to share? I think we have a good grasp of what you do and what you guys have done during this time. Do you have a little special message or anything you'd want to share?
Yes. Our team, we have an amazing team serving. So even in the Tygerberg structure, we have 51 healthcare workers, 3 professional nurses, 2 staff nurses who are doing amazing work. And we also have in the northern substructure, we have 4 PNs and 41 healthcare workers literally working in the front line, and they can use any support we need to be able for our team to be able to provide the necessary care we can, because all of us love what we do because we serve a greater purpose in ourselves. So, getting more involved with our community, donating, supporting in any way possible would be amazing to help us grow to be the amazing team and even take it to greater heights if possible.
Amazing. I think what I have learned from working with you guys over the past few months as well is just how much need there is for the word to get out there, because there is so much work to be done, especially in the situation that we're facing. So it honestly is so amazing. It's such an amazing organization, or trust itself. And I just wish that so many more people knew, and essentially that's what we're trying to do. So thank you so much, Marlee, for sharing. It was really good.
Thank you for that, Kelly.
No problem. Yes.